So continuing on in the lymphatic system, first there's a primary lymphoid organ. Remember, it's going to be thymus in the red bone marrow. The thymus is in the lower neck or the inferior neck. Remember that directional term. And it usually is bilobed, so meaning it's got kind of two sections, and partially it overlays the heart. So you can see the heart here. This, again, T lymphocytes are going to mature here. They're not made here. Remember, they're made in the bone marrow. But they grow up here. So it's kind of like you think where they're born and then they move, and this is where they grow up into adulthood. So they mature here. So again, T for thymus. Thymus is largest in childhood. It stops growing and getting larger at at adolescence, and then it starts to actually shrink. You still have a thymus as an adult. It's not going away completely, but it's getting a lot smaller. So you still have an ability for T cells to mature because you still have a thymus. It's just kind of a smaller section. So it can take a little bit longer just because there's less space for the T cells to be. And you can imagine why this is because the in childhood, you're exposed to a lot of things. You're eating dirt, you're doing everything, you're in school, you're getting exposed to a lot of different illnesses and foreign objects where you might need your T cells. As an adult, you've been exposed to a lot of things, so it's just repeat offenders. You're seeing them again, but they're not new. So we'll talk about kind of memory cells when we get to the immune system. So we still need T cells. You still have them circulating, but you don't need kind of the central location for T cells anymore. So just like with lymph nodes, the thymus has a cortex and a medulla. So the outer part is the cortex, the inner part is the medulla. The cortex is going to be lymphocytes outside, so T lymphocytes again. The inner medulla has kind of corpuscles kind of arrangement and less lymphocytes, and it's going to be regulatory T cells there. So we're going to learn in the immune system, there's cytotoxic T cells, there is helper T cells, and then there's regulatory. So the regulatory are there. So the thymus doesn't have follicles like you're seeing in other areas because there are no B lymphocytes. And again, this isn't like a lymph node where T cells kind of just go through. They don't go and hang out in lymph nodes as much, but they're not ready to fight their antigen. So remember, an antigen is anything that'll cause an immune response or stimulation. So they're not ready to fight their specific match or their specific antigen. They're just becoming more mature, so they are ready to fight. So just think of them as kind of they're growing up in the thymus until they're 18 and they're ready to be released into the world. There's also a blood thymus barrier. We learned about the blood brain barrier, and we'll learn about blood testes barrier in the reproductive section. But the blood thymus barrier is going to keep the blood away from the actual T cells until they're ready. So if we had blood flowing through the cortex and being able to expose these T cells to the blood, they may experience their specific antigen before they're ready. So if they experience their antigen before they're ready, they're not going to have the appropriate response. So we need to make sure they're released into the bloodstream and they're ready to meet their match or their antigen. Another difference between the thymus and lymph nodes is it's not reticular fiber, so it's not reticular tissue, it's epithelial tissues. The other primary lymphoid organ, again, T thymus, T lymphocytes, red bone marrow, B lymphocytes. But again, remember bone marrow is where all the white blood cells are made. So T cells and B cells are made here. T cells leave and go to the thymus, B cells stay. so they stay in the bone marrow. So that's why B for bone marrow. So this is where they mature and grow up. So another lymphoid organ is the spleen. It's on the left side of your upper abdomen, and it's usually just below the stomach. The stomach's actually been removed in this picture. So this is the spleen over here. This is the pancreas, and you have two kidneys. There. So this is not the most numerous. Remember, numerous is going to be the lymph nodes. This is the largest lymphoid organ because it's the biggest. So what does it do? So there's going to be red pulp and white pulp inside the spleen. So the red pulp is going to have to do with red blood cells. The white pulp is going to have to do with lymphocytes or white blood cells. So erythrocyte graveyard, it's going to be where red blood cells are destroyed, because remember 120 days and then they're done. So this is going to be where they're destroyed. Another place where lymphocytes have been made, but they're dividing. They're still maturing, but they can actually start to divide as well if they need to. And another place where the white blood cells can watch out. So can watch blood circulation and try to see if there's anything foreign in the circulation and then have an appropriate immune response. So again, this is where we have breaking down red blood cells. So we break down red blood cells and you can recycle iron. We can store platelets. So if we need a boost of platelets because we need to clot somewhere, like there's a large amount of bleeding, then we can release a store of platelets. Or monocytes is another storage place where if we need infection is happening and we need macrophages to help eat and clean up the mess, then we'll have those when needed. Inside the spleen, so remember if they're in tissues, they're macrophages. So in the actual spleen, not in the blood, macrophages can eat bacteria. They can also eat the red blood cells. So if they're old and need to be destroyed, then they'll consume them, or even platelets as well. Again, phagocytic cell. Spleen does have fibrous capsule that can help kind of contain. There's a lot of blood supply into the spleen, so having a fibrous capsule can contain it, make sure that blood kind of stays in. If there's injury to it, then it can help kind of repair it, having a fibrous capsule. And again, it has white pulp and red pulp. So white pulp is white blood cells, red blood pulp is red blood cells. So again, white pulp is white blood cells. So just think of the color. So white blood cells are part of our immune function. This is reticular fibers, unlike the thymus. So this is going to be lymphocytes, and a lot of times it's going to be B lymphocytes as well. These are kind of surroundings. The white pulp is around these arteries, central arteries, and they do have the storage of the monocytes that they can release when needed. So if all of a sudden you have an infection and you need monocytes to go to that area of infection, instead of waiting for them to be made in the red bone marrow, then you can release them from the spleen. They get there quicker. Red pulp again is old red blood cells, so RBCs go to die. That's the graveyard part of it. So again, the capsule, it can be ruptured if you have kind of trauma or if there's a severe infection in that area. So if there's kind of a large amount of infection, then you have more cells, so you cause swelling of the spleen and it can eventually rupture. When we say to remove the spleen, if it's ruptured, it's called a splenectomy. So to actually remove that ruptured spleen. So yes, we like a spleen, but it's not essential for life. So you can live without a spleen. You just will kind of start to adapt So there's not necessarily places for the white blood cells. You don't have storage of monocytes, but you can do other ways of kind of surviving without a spleen. We can see that to an extent, the spleen can repair itself. So, not necessarily, we used to jump to splenectomies really quickly when there was ruptured, but we actually can see that it may be able to repair itself. So, we're not as quick to go remove it as we were before. As the spleen was removed, like I said, we can compensate with the liver and the bone marrow to take up its jobs. So, it's not ideal, but it can happen. So, MALT or mucosa associated lymphoid tissue. And that again is in mucous membranes, which is going to be openings into your body where most things can get inside. So in your nose, in your oral cavity, vagina, things like, and kind of anything opening, vagina of females. So again, we're going to have entrance places. That's where mucous membranes are. So that's where we're going to have our malt. So in the respiratory tract, where air and other pathogens can get inside, genitourinary organs, so mention the vagina, the penis in males as well, and then the digestive tract. So this is going to be the largest areas. The tonsils are going to be in the posterior side of your oral cavity. We'll see those specifically when we get to the digestive system. Peyer's patches are going to be just under the epithelial lining of the intestines. And then the appendix is another place in the digestive area. So your tonsils, again, we're going to learn more when we get to the digestum. You have a palatine, you have a lingual, and you have a pharyngeal. So we'll learn, again, those locations and everything when we get to the digestive system. They are entrance of the pharynx, or fancy term for throat. They again are going to guard against anything that's either pathogens. So it can be either ingested, that you're eating it, or you're breathing it in, inhaled. They do have tonsillar crypts that are going to be lined with lymphatic nodules, which can be, again, more B lymphocytes. So they can get kind of, the crypts can trap the bacteria and hold it down into the depths of the tonsil.